Go, Dr. House. Does she have syphilis? Is that what's happening here?
You have tested positive for syphilis.
That's impossible.
Oh, wait, she's gotten diagnosed with it before? Love and sex are not one and the same. I love it. She's still horny. Hey guys, welcome back. I'm Jess the MD. Thank you so much for joining me. Today, we are going to be reacting to some clips from the show House. Let's get right into it.
I feel good.
That's your complaint. Your major symptom.
I told her this was a waste of time.
I notice colors more. And music, I'm really hearing music. I'm 82, and I'm supposed to be playing canasta with the other old ladies, but now, when I see a guy with a cute butt, I can't stop looking at him.
Actually, listen to patients, because if they're telling you something has changed for them, listen. Please listen.
And you figure that enjoying cute butts is a sign of disease.
It all started a month ago when Mark rented Gone with the Wind for me, but it had the wrong DVD in it.
Oh, right, I forgot. This is all my fault.
Of course, he was too busy to bring it back.
Yeah, like I don't have a life.
So I watched it, and it had this actor in it, this kid called Ashton Kutcher.
Wow. She's not wrong. Ashton Kutcher's great. I mean, I can't complain, and I get it. She's attracted to him. That's fine.
I think about Ashton all the time. All the time. You remind me of him. Same bedroom eyes.
Really? Hugh Laurie and Ashton Kutcher? Really? Okay, sure.
We're always mixing us up.
I suppose you need to check my heart.
No, that won't be necessary.
I told you.
But I am going to admit you to the hospital for tests.
What tests? She's just old.
You're just insufferable. Your mother has had a sudden personality change. She should be checked out. I'll have a nurse come in and admit her.
Go, Dr. House. I love that. As much of a jerk that he can be sometimes, this was actually wonderful. She's clearly had a change in her personality. He's probably thinking like frontotemporal dementia. Let's see what these tests show.
Oh, Dr. House.
Well, it took you long enough. We've been waiting here.
Mr. Adams, would you step outside for a moment?
Why?
Because you irritate me.
Typically not okay to say to patients or their families, but I guess Dr. House gets a pass. I don't know why he gets a pass, but he gets a pass.
Is my son, Doctor. He's just a little cranky from not eating.
Fine. Mrs. Adams, have you had any recent sexual activity?
What?
Well, I don't suppose fantasies count.
Oh, my God.
Unfortunately, I've hit kind of a dry spell. Only for the last, I don't know, 15 years.
Okay, so he's asking about sexual activity and she's had a personality change. It's been like 15 years. Does she have syphilis? Is that what's happening here? Because people can have neurosyphilis, that's tertiary syphilis, and that can definitely affect the brain.
She's confused. My father died 8 years ago, a heart attack.
Not in bed, dear. Why do you ask?
Because you have tested positive for syphilis.
That's impossible. And insulting.
I don't think it's the first time that Mom has heard this diagnosis.
Oh, wait, she's gotten diagnosed with it before? It's actually fairly easy to treat. It's a penicillin injection in your butt. I've heard that it hurts really bad, but it's pretty easy to treat, honestly. So, wow, I don't know why she would have heard that before and still has it now in late stages of it.
Cupid's disease. That's what we used to call it.
When did you get it?
1939. Prom night, I think. He had a Chevrolet. It was before I met your father.
You said Dad was your first love.
He was. We're talking about sex.
I love it. Elderly people taking control of their sexual health, their sexual life. Oh my goodness. Yeah, love and sex are not one and the same. They can be together, but they are definitely not one and the same.
But I was treated.
Which suppressed it. In your case, for 60 years. But now it's back, and the spirochetes that cause syphilis are eating away at your brain cells.
Oh, that's revolting.
It's not as revolting as chlamydia. It's got seepage. And it's the 21st century. We got flying cars, robot dogs, penicillin. High-dose regimen for 2 weeks, you're cured.
I can't believe this.
Now, pinch yourself.
I guess for the next 2 weeks, I better practice safe sex.
I love it. She's still horny, even with that diagnosis. That's great. I love it. So treatment for neurosyphilis is a little bit different and more involved than typical first or second stage syphilis. This would involve IV antibiotic therapy, still with penicillin, but it's every 4 hours for 10 to 14 days. So House was not wrong. It is for 14 days, but it's really not that easy of a treatment process.
Oh, Dr. House! Hello.
I sent you home.
Well, I came back. I took a cab so my son wouldn't try to chaperone us this time.
I'm sorry, but the fact that the sexual pleasure center of your cerebral cortex has been overstimulated by spirochetes, it's a poor basis for a relationship.
Dr. House is actually kind of handling it like a champ. He's not yet insulting her, but I'm pretty sure it's coming.
Doctor, these feelings that I've been having, is it all because of the syphilis?
Yes.
Then here's the prescription you gave me. Well, it's not likely I'm going to infect anyone.
No. But it'll kill you.
Well, gotta go sometime, and I really don't want to play canasta for the rest of my life.
Oh gosh, this is a tough conversation to have because, well, yes, syphilis is a communicable disease, so it needs to be reported to the public health department and treated, ideally. But also this woman is saying, I don't want treatment, and she has the autonomy to say that she doesn't want treatment. Now, the next question will be if she has capacity to make this decision, because given that she has neurosyphilis, if it has sufficiently eaten away at the frontal cortex and the cognitive executive function parts of the brain, then she may not have capacity and probably shouldn't be making this decision.
I like feeling sexy again and making a fool out of myself with handsome young doctors.
Do you think that I would have given you this if it would stop you from flirting with me?
Well, but if I'm cured,
Then all the spirochetes will die off. The little pieces of your cerebral cortex that have been destroyed won't grow back. Your brain damaged.
That is some psychology right there, working on his feet. Okay, so he is basically convincing this woman that she will still have those same feelings, and honestly, he's probably right. She probably will still have those same types of feelings because her brain is already destroyed to some degree by this disease. But he is not making her feel bad about it, and he's still convincing her in a very tactful way to take the medication anyway. Again, this should be IV, but we'll gloss over that one.
Doomed to feeling good for the rest of your life.
Thank you.
Georgia?
When I stop being contagious, I'll come by for a checkup.
Well, that was great. Dr. House was incredibly tactful and respectful, actually, which is pretty odd for him. That's not typically his MO. So I'm actually really happy with him that he was this nice to an elderly person. All right, it is your turn down below. Tell me if you enjoyed this episode, if you watched the whole episode, and if you didn't, I do highly recommend going to watch the whole episode. Please let me know down below in the comments if you enjoyed this episode of Dr. Reacts. If there are any others that you would like me to react to, also please let me know down below. I'm Jess the MD. Thank you so much for joining me. I enjoyed spending time with you. I hope you enjoyed spending time with me, and I will see you in the next one.